Leading our bulletin tonight, addressing concerns over healthcare costs. The Government Parliamentary Committee for Health has submitted recommendations to make healthcare more affordable. Healthcare was one of the top 3 concerns raised at our Singapore conversation sessions. In response, Health Minister Gan Kim Yong says his ministry is studying the suggestions. Kimberly Spikeman reports.
Expand the scope of Medisave usage up to a certain cap, so it can be used to cover more services such as health screenings. Ensure the continuity of MediShield premium payments and its affordability, especially for the elderly. These are among the recommendations made by the Government Parliamentary Committee, or GPC, for Health, to ensure that out-of-pocket healthcare expenses are kept manageable.
We have received feedback that, there are occasions where patients ran out of Medisave to pay for the premium. And as a result, the MediShield coverage actually lapsed. Instead of using Medifund, to pay for the entire bill, wouldn't it be cheaper if somebody could come along to assist these patients, to pay for the premium, which definitely will cost much less than the total cost of treatment itself. With that, we hope that, the government can look into some form of assistance scheme, to prevent the MediShield coverage of these low-income Singaporeans to lapse.
Another suggestion: to lift restrictions on Medisave use in areas of community care and revise the ElderShield payout.
Currently, we are facing a situation whereby the level of subsidy as well as Medisave usage for social and community care is actually much lower than that of acute hospitalisation. And this has inevitably resulted in patients choosing to stay in the hospital rather than be discharged and admitted to a community hospital.
Also, managing rising healthcare costs. The GPC recommends that the standard drug list cover more essential drugs. Finally, the GPC says existing medical assistance schemes and frameworks should be reviewed and rationalised. The Community Health Assist scheme, for example, now covers low-income households and persons above 40. But the GPC wants the scheme extended to Singaporeans of all ages and all chronic diseases. It also wants more general practitioners to come on board and recommends that the application process for assistance schemes be reviewed and simplified. Over the past 1 to 2 months, the GPC for Health engaged in a consultation process on how to make healthcare in Singapore more affordable. Now, they sought the views of a wide spectrum of people that included healthcare professionals, grassroots leaders, and ordinary Singaporeans.
Health experts have welcomed the report by the GPC for Health on making healthcare more affordable. They say it reflects the main concerns of the average Singaporean. Vamita Mahandas with more.
One of the recommendations made by the committee was to ensure that no one drops out from MediShield, a medical insurance scheme that covers large hospitalisation bills. The committee had suggested that the government step in to guarantee the continuity of MediShield coverage for Singaporeans who cannot afford to pay. Experts say it's a positive step forward, but suggest that MediShield be further strengthened to cover more catastrophic conditions and lessen the burden for older Singaporeans.
You could maybe tweak the premium rates so that the older ages can be cross-subsidized by the younger age group. That's one alternative. Or widen the band, widen the band. Right now, it is very age-specific, right? But you can widen the band and say maybe before you retire, you have to start paying higher premiums, so that when you actually retire and don't have the money, your premiums will be lowered, So over a lifetime, you can actually spread out the premium rates.
Dr. Phua also said a constant review of the Medisave amount used by individuals to support their family members is important so that their accounts are not prematurely depleted.
I would suggest that we actually trick it and adjust it according to the rates of inflation. So you don't have to then wait for every few years before all the problems start. I think if you do very regularly, like say every year, then it should be adequate.
Experts also cautioned that the recommendation of the standard drug list to cover more essential drugs must apply to local usage.
And when we talk about the standard drug list, we're really talking about drugs that are used for common conditions, used by a large number of used by fairly large numbers. So certain drugs that may be subsidized in, say, England or in some other countries, they may be used to treat relatively rare diseases here. Then it doesn't make sense for these drugs to be in the standard drug list.
While experts generally agree with the recommendations in the report, some of them hoped that it had covered more on Medifund, which is the government's endowment fund meant to help needy Singaporeans cope with their medical expenses.
We asked you what you thought about the recommendations to make healthcare more affordable and what you think about current costs now. Here's what some of you are saying online. Dean wonders what it's meant by the term making it more affordable. He says nothing in Singapore is affordable and hopes the government can fix this. Another viewer says he hopes prices will drop to $3 for consulting fees and $1.50 for common cough, flu and fever medicine. He suggests that prices for special medication to be set at $10 to $30 the most. Jack says that if people want low prices for surgeries like a heart bypass, they should just buy insurance. He thinks people should stop taking the help from the government out of context and be grateful. And Ryan says everyone in Singapore is covered with MediShield one way or another, but it's not enough to cover the high costs. He said that even if everyone is covered, it doesn't stop the fact that costs are still high. We love to hear what you think and join the conversation on our Facebook and Twitter.